Hey, my fuzzies, how are you today? And welcome back to Miss Kiwi's Place. Today, I want to talk about something that we don't often talk about, which is treatment and medications. As I've talked about before, I have sickle cell beta thalassemia, and I was just in the hospital for 7 unfortunate days. I normally don't stay in the hospital more than 5 days because after that I'm stir crazy and I miss my daughters and I really want to see them. And a lot of times just being in the same building or the same apartment with them can just change my whole mood. So today I want to talk about treatment and the medications I take as part of my treatment plan for my sickle cell beta thalassemia. We all know that there is no cure for sickle cell. There is um, bone marrow transplant, but that is a very risky option. And at this point in my life, that's not a treatment option that I can afford. And when I say afford, I don't mean monetarily. I can't afford to end up with cancer or something much worse because I chose to try to get rid of my sickle cell. I'd rather just deal with what is going on with me right now and try to work through that and come up with a treatment plan for that gives me the best options for everyday life right now. So let's get into it. So here I have 9 of the 11 prescriptions that I officially have. Um, I take this is um, nausea medicine. This is sleeping medicine. This is morphine. This is Dilaudid. This is constipation medicine. This is anxiety and mood medicine. This is gabapentin, which is for like my nerves and pain that I have in my legs. I have this issue where it feels like my skin is burning, so that's what that is for. I have folic acid, and I have ranitidine, which is an it's Pepsid basically. So Pepsid, folic acid, nerve medicine, Dilaudid, which is pain medicine, morphine, which is more pain medicine, the ibuprofen, which is anti-inflammatory medicine, Senna, no, not Senna, this is Senna, which is constipation medicine. This is Cymbalta. This is Ambien, and this is Zofran, which is nausea medicine. I also have an inhaler as well as the ibuprofen that I take. They just found AVN in both of my hips when I was in the hospital this past week, and basically I will have to take the ibuprofen. If it gets worse, then I will probably be recommended for surgery or or something like that. We'll see what the options are. God forbid that happens. So that is my treatment and basically our medical plan for my sickle cell beta thalassemia. Um, let's see. Let me see if I can break it down a little more. I take the morphine twice a day. The Ambien, of course, at night. The nausea medicine every 8 hours as needed. The gabapentin, I take this. I actually take 3 of these 3 times a day. The Senna, I take that once every day if I'm having issues with my stomach. I actually take my Cymbalta once every day. I take the Dilaudid every 4 hours as needed for pain, especially if I'm having a crisis like right now. I take the folic acid once a day. I take the ranitidine twice a day for help with acid reflux. I take the ibuprofen 3 times a day, and I use my inhaler as needed. So that is my treatment plan. Just that, and I keep a lot of faith and pray and, try to live my best life and enjoy my children as best as I can. Thanks for tuning in. Like, share, comment, subscribe. I'd love for you to become one of my fuzzies. Thanks for tuning in, and until next time, welcome to Miss Kiwi's Place.